Vaccines are among the most powerful public health interventions ever to be developed. Through immunization, the world has completely eradicated the highly contagious disease smallpox. And this is perhaps the greatest public health success in history. Also, infectious diseases such as polio, measles, tetanus, and whooping cough have all been drastically contained through immunization.
There are a lot of diseases that I read in books when I was a medical student. Since I started practicing, I don't see them again.
Because of the immunization, the education, I think that is minimized. Scarcely before you hear of this kind of diseases in the communities this time.
We see vaccination as an investment and not just as a cost.
The World Health Organization estimates that immunization saves about 2 million lives every year. And with higher coverage, it could save up to twice as many.
If you invest a single dollar in immunization, you save in terms of outcome, it's like you harvest $67.
We cannot do without immunization because mortality in children has improved from years past because of the contribution of immunization.
Since the establishment of the Expanded Program on Immunization (EPI) in 1978, Ghana has committed to safeguarding its population against vaccine-preventable diseases. Through concerted efforts and international partnerships, there have been remarkable progress in immunization coverage.
Around 2013, when Ghana attained the lower middle income country status, it became necessary, if we put it so, that the main financiers of immunization program in Ghana, being Gavi, they have a threshold that if your GNI surpasses that threshold, then you are unable to, you no more qualify for their support.
Global health institutions are all going through a lot of financial challenges after COVID. People are still recovering. And Ghana, being a middle-low income country now, is supposed to own part of its health through domestic resources. It's important because it's not everything that donors will give us.
Ensuring access to immunization services is central to universal health coverage. As health financing arrangements become more complex, Ghana faces the challenge of defining institutional responsibilities for its immunization program and ensuring that financial incentives in the system do not disadvantage immunization services. In this documentary, we explore Ghana's immunization financing, efforts to increase vaccination coverage, and the urgent need for greater domestic resource mobilization to achieve vaccine sovereignty. The cry of a newborn baby brings immense joy to families. This symbolizes new life and endless potentials, ensuring that every child receives timely immunization protects these precious new lives from preventable diseases and securing their health and future.
Actually, we started with the 6 antigens or 6 vaccines that we used to say it fights against 6 childhood killer diseases. And we've actually progressed significantly, such that currently we are introducing or we are deploying 11 vaccines in the routine immunization program.
Ghana is one of the most performing countries in the Gavi portfolio. So we are supporting vaccines, HSS, which is health system strengthening. We pay for cold chain equipment, also technical assistance.
Immunization does not only preserve the happiness and dreams that come with each newborn, but also strengthens the societies by fostering a healthier and more resilient population.
Because sometimes the boy who yet tends to say, and Qualano so moon fat or moon one sanya mana, now mom say drew na. Ebia or mwapomudin or mo yari Nyamati be gugu or moho or mapomudin and ye fine. Hence, he say a woman, Sanya Manyama yarin kitten in Yamani Nano. Ye who ewo Nkwalane.
Despite these successes, Ghana's immunization program faces challenges in delivering vaccines and securing sustainable financing.
The clinical services kind of pays for itself, more or less, okay? With public health services, you don't pay for public health services. It's a common good, okay? So most often the public health services funding is an issue.
Sometimes ye kwa to make us so Vaseline and buy it's in a moment another date. Vanessa high because sometimes maybe you have somewhere to go and you're ready that time now call you and you bet me have say date no mobile phone maybe our baby kwa maybe I was say ujai now attend it to a be monso or they just ignore mumba.
A district like the Afan Plains North and South, there are communities that to get there you need a boat. Yeah, because the communities are on islands. For such communities, I mean, you have to plan. Going there is a major project.
For Pru East especially, they don't have a safe boat. The boats that they have, Ghana Service has a boat, but that boat is more than 20 years, and so we need to replace that boat. So sometimes when they have to go out, they will have to go and then hire out some of these boats and then go out. From time to time, we've had a bit of challenges with some antigens, some of the buses, and so we have had to vaccinate children in sessions where at the point of time we were vaccinating, we didn't have some particular vaccines to offer them.
Pregnancy, 9 months travel is not an easy thing. And for you to give birth and after giving birth vaccination, there is no vaccine. Then our mother is going to go back into that trauma of the 6 killer diseases.
I don't want to think about that, but that means that we don't have any future. That will mean that children born, when they are born, the first thing we give them is BCG for prevention of tuberculosis. They are given polio. So what will happen is that you see a lot of people with deformities, polio. Then what are you doing? They will be limping on their legs. They will just shrink. Is that what we want? Then there is no future.
Ghana has been inconsistent in honoring its annual co-financing obligation towards vaccine and logistics procurement since entering Gavi's accelerated transition phase. Government defaulted in 2014, 2016 and 2018. This resulted in occasional vaccine stockout at various health centers nationwide, threatening the gains made over the years.
From 2014-2015, the government was unable to meet those co-financing obligations. Somewhere around 2017, thereabout, it occurred again. Then I think in recent times, in 2022-2023, we again heard of the challenge that arose with our vaccine stocks in country, where again it revolved around those ability for the government to be able to meet this particular obligation.
Any co-financing obligations that we sign onto as other countries, we must make sure that we meet it. If we are not able to meet it, even in bits, it's better. But if we don't pay it at all, then we are not interested in the citizens. I mean, can you leave people who are all sick? So I'm just calling on the government to prioritize immunization.
Our immunization financing is largely dependent on external donors. It means that it's not sustainable. And so in the long term, we have the challenge or the risk of losing the gains we have achieved so far.
I don't see how depending on donors is more sustainable than we ourselves trying to create a system of financing vaccination programs. because all this while is been dependent on donors. And so the day the donor says, I want, what happens to our children?
The make aban say, onye yamwa, omwa yen, sikane se so de ba, na yenya aduro no, ye de hwe yen kwala, awofo, ye de hwe yen manfo no, oma na nye intentem so, emre so de ba no, eso de duru amaye.
The timely payment is very important. The problem is that from the time you pay to the time vaccine are in country, depending on the type of vaccine, it can be between 4 months to 6 months. And the closer we are to the end of the transition, the more earlier the country should pay for the vaccines. For example, if you need vaccine in June, you have to pay in January. But if you need the vaccine in January, it means you have to pay a year ahead, at least 6 months in the current year for next year. And this is the main issue that Ghana could face. And there is a risk that if it doesn't work, we could face outbreaks due to shortage of vaccine.
Government consistently has been unable to allocate or release sufficient funds to the health sector each fiscal year. This results in logistical constraints including outdated or insufficient vaccine cold chains, transport challenges, shortage of child health record booklets at service points, lack of human resources to reach remote areas, and urban poor communities.
We have hard to reach communities. We have some communities which are overbanked, some are very difficult to reach, mountainous communities and the likes, and then you need more resources to reach those communities.
Every year you have people who qualify to move to school for further studies. So every year you have substantial amount move, but we are not getting replacement. You see, so they keep going and going. And then the gap becomes huge. The staffing gap is huge and yet you still want to keep up with your performance and it's quite difficult. So now we have a lot of staffing issues, especially the community of nurses who are the real soldiers of immunization.
It's really a headache for us that even our half funding is bringing us this way. Then what if we are supposed to bear all the funding for ourselves?
There are 4 vaccines that government is paying for fully as we speak. And for all those vaccines, government is making those commitments to ensure that we are able to get them through. There are about 7 of them that is being co-financed, and that is again where sometimes the challenges also arises.
Ghana, with its gross national income per capita surpassing the Gavi support threshold, began the accelerated transition phase, aiming to be fully self-financing by 2030. To achieve this, the immunization program must overcome various financial and program-related risks to ensure its sustainability.
It's critical that the country begins to look within and try to mobilize the resources and also set up the systems that ensures that come 2030, when we are expected to fund our vaccine or immunization program 100%, we will be up to it and be able to ensure that there are no shortages of vaccines and our children are receiving vaccines timely and, of course, help to prevent them from getting the diseases that are preventable.
Late 2023, the ministry actually put together experts and stakeholders to deliberate on best way we can actually ensure that, yes, the financing of immunization doesn't pose so much challenge to us as a program and as a country. And the sources that are being looked at is to see whether the budgetary allocation for health in general, which is expected to be at least minimum of 15% across countries from the Abuja Declaration. If we are able to reach that target, then what comes to health generally will be substantial to be able to be taking care of that of the immunization fully.
The role of Parliament in achieving vaccine sovereignty is key. Parliament can direct the allocation of public funds, approve budgets for immunization programs, establish financing mechanisms for immunization services, and oversee the implementation of new immunization-related policies.
Budgets are prepared by the government, and then it comes to us for consideration. We cannot add, but we can advise the health ministry what we think is the way forward. And then we also do a lot of advocacy. What we actually do when we are debating on the floor is advocacy to government to pay particular attention to A or B. And when you go to National Health Insurance, their budget also comes to the Health Committee. So we also help in giving them direction as to their formula, where to pay attention. And you will see that for some years now, we have been paying particular attention to immunization. So even though we don't make the budget, we play a role in advising either the the Ministry of Health and its agencies what to do to help with immunization or primary health care.
Ghana has no specific earmark for immunization, but the Ministry of Health uses a portion of the earmarked value-added tax revenues that fund the National Health Insurance Scheme to meet the co-financing commitment. Budgetary constraints in the health sector have led to discussions about alternative ways to generate domestic revenue for the immunization program.
We are relying on the NHI fund or the NHI levy that is actually being collected from the citizenry. When that is able to increase, then what comes to immunization also by and large will increase.
But we all know the NHI cannot pay for everything.
Also, discussions are underway, engaging various stakeholders to see how best maybe the COVID-19 levy could also be looked at, and then repurposed to look at generally funding emergencies, which will include public health interventions or vaccination inclusive.
We also get some kind of revenue from our oil, from our gas, from our minerals. I mean, even the COVID-19 levy is there. And so it's important that certain interventions that donors would like to invest, our government should ensure that they invest into those, especially things that are more at the primary health subnational level.
Some countries, for example, have secured the immunization financing by creating what we call a trust account, which is a specific income that goes into an account that will be dedicated solely for vaccine payment.
We have a plan that has been drawn or put together with the leadership of the Ministry of Health, that is looking at how we can systematically follow through some of these suggestions. The oversight committee has been constituted, and we are hoping that with these proactive steps from the government also, our road towards self-financing of vaccine is becoming a reality by and large.
Some of the things that they've put up, or established, like the National Vaccine Institute and all these things, are meant to facilitate that. So if you have such an important institution to lead the facilitation of some of these things, then you can be assured that by the year 2029, 2030, at least you should be able to undertake some of these interventions for the people of this country.
We want to achieve self-sufficiency in vaccine production to meet future national, regional, and continental needs for health security, with Ghana, Rwanda, and Senegal determined to become vaccine manufacturing hubs in sub-Saharan Africa.
When COVID came, countries that were manufacturers of vaccines, they served themselves before serving us. And it makes sense. How can anybody manufacture, serve you and die, and then later serve itself? So if we also become a vaccine manufacturing country, then we know that in case of any emergency, at least we have the facility to even fail.
If we are able to have our researchers well resourced to have our own credible, trusted vaccine, I think the acceptance by our people will be better, and it will also reduce the cost. But in the interim, as a university, we strongly support any organization, any coalition, any NGO in the space of vaccine financing, vaccine usage, vaccine education, name it.
Local mobilization of resources is something that we'll be able to do. I don't know, I'm not sure how it will be done, but I think there should be some form of incentives for local industries for them to be able to want to support any drive by government to be able to have our own vaccines, procure our own vaccines. If we need to procure from outside or we want to manufacture, we need to be able to get local industries or corporations to be able to want to support. But they will need some form of incentives to want to be able to do that. So I think that is how we should be able to go about it.
If we are able to produce our own vaccines, well, then it means, I mean, they are where it's needed, right from factory to the client. So we cut all the cost of shipment and when we talk of shipment, it's not just, it's a whole system, the cold chain, the transportation system, it's a whole ball game altogether. Okay, so we cut all that away if you're producing in country.
I will urge the private sector to look at how best we can invest, because when we invest in that particular arena, Ghana can serve as a hub where we can manufacture, and other even African countries within our sub-region will also actually benefit, and that comes with a lot of benefit.
The partnership is happening in different countries, so Ghana should also explore the possibility of that partnership, especially getting the vaccine down, ordering it, even buying it and paying it in maybe tranches. This discussion can go on. So we need to partner private sector. And I also continuously say that not just private sector, civil society is also private sector. They should partner them, and the traditional leaders, the people who own this.
We per se have a say in our communities. Hence, when we go with them, our communities are more involved with the immunization programs, and they come out more with their children, because normally we educate them before the program starts. Hence, when we collaborate with them, it's more effective.
We don't just want queen mothers to be just a loose part of it. We want them to be an integral part of it. So we selected 10 queen mothers from the region, and we have trained them on the issues of immunization, as well as in advocacy and communication skills, so that they would actually be a voice for immunization financing in the country, as well as being advocates of immunization in their communities.
For the CSOs, there are two main roles that at least we think they should play. The first role is the awareness creation and social mobilization. This is very important. Then the second role is to make sure vaccines are available through advocacy toward the government and all the partners that are in country, because it's not only the government that pays for vaccine or vaccine activity. So there are other partners, and these partners should help the government to secure funding and all the mechanisms that will help the country to sustain its program.
The scope of immunization in Ghana continues to grow as new vaccines are developed against persistent and emerging diseases. Since 2019, the pilot of malaria vaccine in 7 regions has significantly reduced child mortality. Stakeholders in the health sector, including mothers, traditional authorities and NGOs, are urging government to, as a matter of urgency, push for the nationwide rollout of a malaria vaccine.
Hey, malaria is the common diseases that affect children. Hence, the vaccine is coming to help them, because the mothers will be free, because it's malaria that sends them to hospitals. So with the vaccine, I think it's the best thing that has happened to mothers.
If it affects children, a lot of things happen. I mean, if they are very little, it could even result in death. They will miss school, and once a child misses school, you know, the mother has to stay at home to look after the child. So the ripple effects are many. So it would be great if the vaccines could be made readily available, added to our routine vaccines that are given as part of the routine immunizations.
The malaria vaccine has really been helpful, because in home municipal 2023, we recorded 0 mortality related to malaria in children under 5, you know, the whole year. So the vaccine has a lot of potentials to save our children from needless deaths of malaria, from malaria.
For Bunu is our malaria case fatality for the under 5 has really gone down. Now we are doing less than 0.1% as case fatality rate, which I think is good.
We are delivering the vaccines in Upper West region, Volta region and Uti, then Bono, Ahafo, and then Bono East, and then Central region. We are anticipating that by September 2024, we should be able to scale up to additional 43 high priority districts. And these districts are mainly in Upper West, Savannah, Northern region, and Western North. So about 4 additional regions. Then the last phase of about 125 districts remaining will be considered over the period of the transition, depending on how we are able to raise the co-financing obligations and also the vaccine availability.
Once the country is going through these economic difficulties, it will be very difficult to say that you want to self-finance now. You will need a bit of time to prepare and get out of the woods to be able to do that. So some discussions have gone on with Gavi and Global Fund and other important stakeholders to just move it to 2029. So by 2029, we should have a roadmap, clear strategies outlined as to how we want to transition from the co-financing arrangement we have now to a fully self-financing program. And then from 2030, we begin to do that.
Cervical cancer ranks the second most frequent cancer among women in Ghana. Women aged 15 years and above are at risk of developing cervical cancer. Current estimates suggest that every year, 2,797 women are diagnosed with cervical cancer and 1,699 die.
I think it is time government should really invest into cervical cancer or HPV to prevent cervical cancer in our girls. This is the time, and we must invest in it now, because it's the best way to invest. It's an investment, because the money you need to treat one cervical cancer is more than the money you need to prevent it through the HPV. And so we are our organization and all other partners, we are calling on government to invest in HPV.
So we are waiting for the final feedback from the review committee of Gavi that usually supports the introduction of these vaccines. For sure, they've given us some assurance that if the approval goes through by the third quarter of 2025, we should be able to introduce the HPV vaccine into our routine program.
Mothers need their kids to be vaccinated, and it's a concern for me, it's a concern for all women.
With the zeal that we've started or responded to the shortages that happened some couple of years ago, we're able to continue so that we do not go in that direction again, because the consequences are grave and we cannot afford to let our children come down with the vaccine preventable diseases.
Investing in immunization is securing the future for our future generation and generations yet to be born, because it's cheaper. We all know that prevention is better than cure.
I mean, there's that full commitment from government through the ministry to do this. And like the Gavi board came to Ghana for their mission. That was last December. And I'm told the proposal was presented to them and they accepted it. So it means that we have to go back and work on some of the strategies that we have put in there, which will enable us to exit the current structure or the current program, so that by 2030 we begin to fund some of these interventions ourselves. We will not depend so much on Global Fund or Gavi to do this for us. So once we have a roadmap and we are committed to following it, I believe that we should be able to exit. We need to find the money. It's a will, it's a political will. If that thing is there, you need to find the money to do it.
If we were not to have immunization, many of us would have been having polio, would have died, would not be here. Even the president, parliamentarian, would have all died because many of us are from villages. So it's important that we prioritize immunization, and I'm calling on the government to ensure that we meet our co-financing obligations timely. The timely is important because if you pay late, it will not achieve the purpose.
Ghana is at a critical phase for the sustainability of its immunization program as it transitions from Gavi's support. Immunization is an investment and must be sustained indefinitely, requiring long-term financing. The nation has an opportunity within the next 5 years to plan to fully fund its immunization program. It is imperative for a multi-stakeholder engagement involving government, healthcare providers, insurers, civil society, NGOs, and the private sector to implement comprehensive strategies towards the attainment of vaccine sovereignty by 2030.
In Ghana, land of hope and dreams, vaccines are more than what they seem. They guide our lives, help us to grow. A healthy future they bestow. Mothers, please hear this song. Immunize your babies, keep them strong. With each tiny prick, a shield we raise to protect us through our days. Our country stands at a crucial place to keep vaccines flowing at a steady pace. We must invest, plan, strive to keep immunization alive. For in 5 years, we have a chance to fully fund and take stance. Government and all must unite to ensure our future stays bright. Hope for Future Generation has led with a fair project to secure a future bright. Immunization is the way to safeguard our children every day. Let's aim for vaccine sovereignty and build a future strong and free.